Cultural competence in healthcare for Asian Indian population. India is country in South Asia. Its second most populous country, the seventh largest country by area. By early in 20th century, India is making follow the railroad south from Canada to United States. They began working in lumber industry in Washington State. The population has grown with 2.4 million Indian immigrants resident in the United States at 2015. The population of India speaks many different languages, including Hindi, English, Bengali, Tamil, and Urdu. Hindi and English are the official language of the Indian government. Most Indians do not like to negate, so they might say yes to things when they want to say no, with a side-to-side head movement. So do not confuse with head shaking for no. For older Indian women, do not engage contact with male, example with handshake. For touching with feet or shoes is very loose for Indian people. 40% of India are vegetarian, so they either on wheat, barley, and millet. Common spice choice include garlic, ginger, and mustard seed. Tea is India's favorite drink. India food eating by right hand using finger or spoon and fork. Hindus are offended by many meat from cow because cows are considered sacred animals. Hindus many fast on different days depending the god they worship. Customs, traditions. Indian women are often seen sporting sari. The sari is single coat, is easy to make and comfortable to wear. Religious symbol. The Indian tradition and sculpture contain various signs and symbols which have multiple meanings. Indian dance. The Indian dance are not different. Different forms of dance find origin from different parts of the country. They are a way of representation of the particular culture from which they originate. Indian food. Indian food style of cooking varies from region to region. Indian food have significant reputation for its extensive use of spice and herbs, and their use hand eating. Religions of Asian Indian population. There have many varieties, but the largest of the group include Hindu, Christian, Muslim, and Sikh. Hinduism have many versions believed to worship a variety of gods. Hinduism that commonly affect health, decision, and communication between patient, family, and provider include. Karma is a law of behavior and consequence in which action in part live affects and circumstance in which one is born and live in this life. The bandy inside worn by many women of Hindu faith and a red dot on the forehead. Traditionally, a symbol of honor and intelligence, today is common for women to wear it as decoration. Many Hindus use meditation and prayer. Vegetarianism among Hindus is based on belief in reincarnation, the idea that the soul of person enter back into creation as living being. Dead and dying, family members will desire to be present for dying patient. The process includes chanting, prayer, and incense. The body should be touched minimally by healthcare workers. The family will desire to clean the body and wrap them in red cloth. Mourning family members may shave their head. Barman is actually requested at the funeral to recite holy chants. Ancient Indian families have hierarchy of decision makers in place, actually beginning with oldest son as primary contact and disseminator of information. Family may be restricted to disguise personal, emotional, and financial issues with healthcare providers because these matters are considered very private and traditional, are not shared with anyone in household. Family members may request to sufficient hold information from their loved one who is ill due to concern that tests about illness may negate the ill to live. Health concerns. Common disease. Asian Indians may have high risk of obesity, diabetes, and hypertension. Asian Indians have 3 times the prevalence and rate of coronary artery disease as compared to general American population. Asian Indian women are at high risk of osteoporosis. Challenge in treatment. Patients unavailable to follow up complex treatment regimen. Do not understand the risks of improper use of medicine. Do not believe in treatment process, side effects of medication, complexity of treatment. Having an insight into illness process and barrier to care medication. Patient limit access to healthcare system clinic and pharmacy high cost of medic action. Language unavailable to communicate in English. Lack of translation unavailable to read medication label in English. Less of knowledge of available of healthcare. Sufficient limit knowledge on cost of drug and insurance cover. The older India Asian cost of treatment expensive. Most are dependent on their children. Inadequate follow-up or unclear discharge planning.